Yes, today we are looking at DKA. This is diabetic ketoacidosis. It is diabetic ketoacidosis, DKA. Now, what causes what is the DKA? This is simply a complication. It is a complication of diabetes mellitus patients. It comes as a result of severe lack of insulin. It is caused by severe lack of insulin. Now, you know very well that it is insulin, the normal way how we get energy in our body. It comes about, we must have insulin. We must have insulin. We must have we have the cells demanding energy. We have also what we call the sugar or the glucose. So this glucose must be in the blood saturation. This sugar must be in the blood saturation such that insulin comes in and transports this, helps this saturating sugar, helps this saturating sugar to be taken to the body cells or to the adipose tissues. So now, if the insulin is not there, then manufacturing, actually formation of energy from, we have cut off, now insulin is not there. So making, let's say, formation of energy will now not take a place from the sugar. Why? The insulin is not there because there is severe lack of insulin. There is severe lack of insulin. So since there is severe lack of insulin, it means that the insulin will not take this blood sugar to the cell, to the adipose tissues. So energy will not be formed, and the body will be in need of energy. What will it do? Now, what it will resort to, it will now say, now I've failed to get energy from the sugar. What should I do? Or if I go to the fats, I will get the sugar, the energy. So it will come to the fats. It will break this fat. It will break the fats and get energy. But it is getting energy, but also the byproduct is ketone bodies. It gets the energy, fine. We wanted the energy, we have got energy from the fats. We are using energy. But now, the byproduct here, we have got ketone bodies. These ketone bodies, they are the ones which cause the problem here in this situation. The complication comes about because of these ketone bodies. These ketone bodies, they are acidic. So, being acidic, when they are in the blood saturation, they change the acid, they make that blood to be acidity. You know, the pH of the blood must not be below 7.3. So here the pH will now be the pH now will now be greater, will now be less or equal to 7.3, and it will lower, it can even reach like a 5 or 4 depending on the severity. Now if it reaches 4, it is too acidic. This situation will now make somebody to feel bad, and it is fatal. If you delay, somebody can even die. So it is an emergency, this complication. So what next now? Let us look at the causes. We have seen how it comes about. It comes about from the body resulting to failing to manufacture energy from sugar, and it results to manufacturing it from fats, and as a result it will get its energy, but the end results will be there will be a byproduct of ketone bodies, and these ketone bodies, you know, they are acidic. So being acidic, they lower the pH of the blood, and the blood becomes more acidity, and that condition will lead to DKA, diabetic ketoacidosis. So let us look at the causes. What causes these situations to come in, clock in? Now causes of diabetic ketoacidosis. Causes of diabetic ketoacidosis. The cause number 1 is undiagnosed diabetes mellitus type 1. You know, this complication can clock in just abruptly. So make sure that you are diagnosed and you know your status. But it can come abruptly and you find yourself in this condition. Why? Just because you have not been diagnosed before. Another thing is less or no insulin. Less or no insulin. So that's we have seen how insulin helps us to maintain the body energy need. So if it is not there, it will lead to this condition, because there is no insulin. It will result to the other option B of going for the fats, and the end result is what causes this. So if there is nobody, there is no insulin, this is one of the problems. So now another is illnesses, or there might be surgery of the pancreas, and so many other infections can also lead to this condition. Even medication, some medication can worsen, but majorly this is what causes. So let us go on and look at the next subtopic. We are going to look at the signs and symptoms. How are we going to know that somebody has DKA? Signs and symptoms. Signs and symptoms of DKA. Now, sign number 1, you'll find that the earliest signs to come, you will feel too thirsty. So that is, we call it scientifically polydipsia or dipsia. Here, this means that you feel too thirsty. Then there is polyuria. There's also fatigue. These are the signs, the major first signs to happen to somebody having diabetic ketoacidosis. Now, after these signs have come in, there are some more severe signs. More severe signs come in. More severe signs. More severe signs will come in, such as you will start seeing somebody getting confused. So there is confusion. There is somebody will have nausea. Somebody will start vomiting. Somebody will get abdominal pain. Difficulty in breathing. Difficulty in breathing. Then also somebody will start feeling a fruity scented smell. Fruity scented smell. So will others, there might be other signs. There may be other signs like one. There are other signs like flushed face, muscle stiffness. There is also dry skin, especially the mouth. You can see somebody having dry mouth. So advice or what to do when you get such a condition. You need to seek for immediate medical attention. Immediate medical attention. Secondly, make sure that you deal with qualified staffs. Qualified health workers. So if there are emergency services, you are advised to go for those ones, or you call the people who deal with those emergency services. So next, Now, prevention of diabetic ketoacidosis. Now, the prevention here, the prevention method, the very first thing is that here, somebody with diabetes, it is so important to note these points now if you want to avoid going into such conditions. The first point here, you need to, even let me first with those ones who are not diabetic, because one of the causes of this condition, getting this complication, is that some people are not diagnosed. So make sure you go for medical checkups. Medical checkups frequently. Because some people, they just get this situation abruptly. Then, if you are diagnosed and you know you are diabetic, now what are you going to do? So, manage the food, manage your meals. Your meals according to diabetic mellitus food plan. In our previous video, we saw how to do it. So if you missed that video, you need to scroll back and view in that video. Then another thing that you make sure that you carry out exercises. So you drink plenty of fluids. Never miss an insulin injection. Never miss an insulin injection. Make sure the insulin is not expired. Make sure the insulin is not expired, and make sure it is well connected. For those ones who are using the insulin pump, there are those who use insulin pump, so the cannula and the tube must be well connected. So when you follow sick, make sure that you even tell the health provider that you have also diabetes mellitus. That is, in case you follow sick with the other illnesses. So make sure that you inform the doctor about your diabetes mellitus status. So those are the preventive measures of diabetic ketoacidosis condition. Diagnosis of DKA. Diagnosis number one: when the patient arrives at the health center or at the hospital or at the clinic, the first thing you do when you see the patient with such conditions, such signs and symptoms we have talked about, make sure that the first thing you do a random blood sugar. And if this person is having DKA, it must be that random blood sugar must be greater than 250 milligrams per deciliter. Then another thing which you do also to confirm this DKA is to look for ketone bodies. We have seen these are the trouble causers, the ketone bodies. So you try to check whether the patient has ketones in blood. Also, you look for ketone bodies in urine. Then you check for the pH. The pH, if the person is diabetic, is having this DKA, it means that here in pH, the person will be having less than or equal to 7.3, the pH. The blood bicarbonate, the blood bicarbonate, you find that it will be 80 meters per then you can go further and do arterial blood gas. You can go on and do osmolarity blood test. Also, what you must do also is blood pressure. Of course, the pulse rate and the heartbeat will be checked here. This is the ABG. This is arterial blood gas, osmolarity blood test. This is blood pressure. Then also we have basic metabolism panel. This is basic BMP, basic metabolism panel. You also do that test. So here we have management and treatment. Management and treatment of DKA. How do we manage and treat this patient? You have to start with IV fluids immediately. IV fluids. These IV fluids will help to correct dehydration. The IV fluids. Then insulin injection will help to lower the blood sugar. Now, other treatments will depend on other underlying causes. Underlying diseases. So when you are sent home, so there is the way you can manage it. So management at home. When you are at home, make sure you don't take long to go for checkup. So know your blood. You must know your blood, the random blood sugar. You do checkups to know the level of your blood sugar. After knowing the level of your blood sugar, if it is too much, make sure you check your urine or blood for ketone bodies. Ketones in blood and urine. Then follow health workers' instructions. Try to eat normally. Drink plenty of water. Actually, we are saying plenty of fluids. There are no more other fluids. Take water. Then you have health workers' numbers, telephone number. Phone numbers. When you're discharged from the hospital or the health facility, don't rush to do exercises, but it is the doctor now to tell you when to resume exercises. So when you're taken to the health center or to the hospital, when you are bad low, usually this condition will start. You will start normalizing within the 24 hours. But now, sometimes it depends on the other underlying diseases that they might delay you. So, but if there are no more other whatever, and also the severity depends. So, we're going to look at so complication. We shall have damage to organs. Damage to organs like the kidney. Like the kidneys. There will be also death. There is cardiac arrest. There is hypokalemia. There is also cerebral edema. Cerebral edema. There is also pulmonary edema. Somebody might go into coma. So we are done with looking at diabetic ketoacidosis. I wanted to look just slightly on what they call ketosis. You know, some people, they confuse ketosis with diabetic ketoacidosis. So diabetic ketoacidosis is for people with diabetes. Majorly, the KDA majorly affects people with diabetes type 1. Then the ketosis, it does not affect people with diabetes. Actually, it is development of ketone bodies due to hunger. It is ketosis. we are talking about ketosis. This condition comes in as a result of hunger, whereby we saw that we get energy, from sugar. Then there is insulin. Then we get energy. Now with ketosis, with DKA, we saw that there is no insulin. That's which will help to take this glucose to the other side to get energy. So this is without insulin, it causes a DKA. But now this time we have insulin. In ketosis we have insulin and we want energy. Now we have insulin, we want to get it from glucose, but glucose this time, the other time with DKA there was no insulin, but this time we have insulin but the sugar is not there. You are hungry, you have not eaten starch, or you have not eaten sugar rich meal. If you have eaten or you have stayed hungry, you're hungry. In major, it is about being hungry. So when you are hungry, all the glucose has been utilized and it is not there. But insulin is there and it wants energy. So the body will leave this system of getting energy. And also go and break the fats to get break the fat to get energy, and also will get this ketones. So here you will have ketone bodies in urine, but you will not. But when you do the random blood sugar, it will be normal or even less because you're too hungry. It will either be normal, even slightly less than normal, because you're hungry. So you will find that the random blood sugar is normal, but the ketone bodies are there in urine or even in blood. And this condition, it is not even fatal. So sometimes people confuse ketosis with diabetic ketoacidosis. That's what I wanted to talk about, that ketosis. That's the point I wanted to bring out, so such that they don't confuse diabetic ketoacidosis with ketosis. So next time we are going to look at HHS, which is hyperosmolar hyperglycemic state. Thank you. Stay tuned. Subscribe. There is a word on this side written subscribe. Just touch there like this. Bye bye.